Peyronie's disease is an abnormal curvature of the penis that happens typically in the later decades of life between the ages of 40 and 70, where you make a scar that's on the tissue of the penis that creates this abnormal curvature. That scar happens just because your body is remodeling the tissue abnormally. Every time we use our penis, every time we have an erection, you get small tears in the tissue of the penile bodies. That's normal. Your body is supposed to heal that, get you back to normal, and get on the way. In guys that have Peyronie's disease, there's something that happens with their inflammatory response and their healing response that leads to this scar formation. For guys that come to see me with Peyronie's, you can feel this hard nodule on the side or the top or the bottom of the penis. That's that scar that the body has been remodeling. So it's just this abnormal remodeling or healing process that leads to this curvature. Peyronie's disease isn't anything that you did to cause the curvature. The body is supposed to heal these small tears that we get in the penile tissue every time we get an erection. For guys that have Peyronie's disease, there is an unclear reason that they create a scar instead of normal healing tissue. There are some associated diseases with this that may contribute to the reason why, but in general, the guys that have just Peyronie's disease and nothing else. And so it's, for some reasons that we don't know in the medical field, your body is just adding this scar where it should be healing normally. For some guys that have Peyronie's disease, the curvature is either not that bad or not bothersome to them or their partner. In those cases, I don't recommend treatment. You can still go ahead and have normal sexual intercourse, normal sexual encounters. As long as it's not bothersome to you or your partner, there is no reason to fix it. Peyronie's disease, because it's a remodeling or a scar on the erectile tissue, can actually affect the blood flow and the erections that you have. If that's the case, then there are treatments that we can do to address both your erectile function and the curvature of your penis. The issue with the curvature is sometimes the curvature is so severe that either you can't penetrate for sexual encounters, your partner has pain with sex, or it's just something that is bothersome to you and embarrassing to you, and that's another reason to get it fixed as well. When you come to see me for a Peyronie's consult, oftentimes patients have already diagnosed it on their own. They can feel the scar on the side of their penis. They tell me that they've had this progressive curvature that has worsened. Maybe at one point you had pain. What I will do in the office is I will give you an erection. So I do that with an injection into the penis with a medication that gives you an erection and measure the curvature of the penis. I also do an exam where I check the scar that's there. If the scar seems severe enough, I will sometimes put an ultrasound machine on that scar as well to see if there's calcium deposits in it. The calcium deposits can make it difficult to treat, and sometimes surgery is the only option for those patients. So there's this multimodal diagnosis and treatment option, depending on what the exam shows, but we usually start with an erection and measurements and a discussion of the history. Peyronie's disease is a little bit tough in that there are really only a couple of options. For some guys who have this scar on the curvature is not severe enough that it warrants treatment, and that's a discussion that we would have in clinic. For patients who have bothersome curvature or are embarrassed by their curvature, there are really three options. The first is an injection that we do into the actual scar. That injection has a medication that breaks down the scar tissue in order for your body to remodel that and allow your penis to straighten out. That is for select patients and only works for select patients based on the history and physical. Alternatively, there are two surgical options. The first is where I would go into the penile bodies and put some stitches in that would actually pull the penis straight. That's an option for guys who have minimal curvature and have enough length that they're not worried about length loss. Peyronie's disease unfortunately does shorten the penis, and with that procedure where I do what's called a plication or put those stitches in, you can have a little bit of length loss. Not everybody does, it's probably somewhere between 1 and 2 centimeters, but that's a pretty easy procedure that can give you a nice result. Lastly, for guys that have severe curvatures or calcified plaques where they have that calcification of the scar, we can do a procedure where we excise or incise the plaque and put a graft over the top of it. A graft is a piece of tissue, usually something that's processed. It's cardiac tissue or heart tissue from a company called Coloplast, where we put that on the defect and essentially straighten your penis out by putting another piece of tissue in. The different treatment options are discussed with you at your clinic appointment, and we kind of go through your goals and decide what's best for you. For the injections, which are made up of collagenase, there are some patients who, if they have calcification of their scar, are not candidates for that injection. Likewise, the surgical treatments can sometimes cause erectile dysfunction or lead to worsening of your erection. So depending on what your baseline erection is, some of those might not be the best option. For patients that have erectile dysfunction and Peyronie's disease, the best option is to actually put a penile implant in, which will both straighten the penis and allow for improved erectile function. So just like every other thing in my clinic, I have you come in, we talk about all the options, we go over the pros and cons of each, and I basically lay it on the table for you to make an informed decision with me as to what's going to be best for you. In general, once Peyronie's disease gets to where you have your curvature, it does not typically worsen. You can have a worsening of your erectile function if your Peyronie's disease is not treated, but if it's not severe enough that it's causing you problems, so you're not having issues with penetration, not having issues with erections, not causing your partner pain, there's no reason to treat it, and it's not going to cause any long-term issues. That does not mean that you won't develop another plaque somewhere that may worsen your curvature or erectile function. But in general, if it's not causing you issues when you come to see me, there's no reason to treat it and there's no long-term sequelae of that. But if something was to worsen or you were to start to have any of those issues that I mentioned, then we could reassess.